Hello, both sides of the conversation family. We welcome you to this virtual space crafted especially for you. My name is Jada Curry, and I'm both sides of the conversation's marketing director and graphics design specialist. I want to take some time to ground us all as a community into this space we are about to open up in, so let's go through our community standards. Both sides of the conversation is providing a safe and honest space for open conversation, so we ask that you all be respectful of that. We also ask that you be respectful of each panelist, host, and participant. We do encourage healthy debates and conversations. Don't personalize anything with anyone. This includes name-calling, bullying, trolling, or shaming. This will not be allowed or tolerated. Your perspective is yours. It is not a prescription. You do not have to agree, but show respect. These community standards apply to all of our live shows and any virtual spaces that we hold on social media, including YouTube, Facebook, Twitter, or Instagram. We want to make sure that we are caring for each other as a community. This is our priority in all of our endeavors as both sides of the conversation. With that being said, I hope you enjoyed today's show and continue to stay in touch with us via YouTube, Facebook, Twitter, Instagram, or all of them. All right, thank you for listening and see you soon.
Hello, everyone. Welcome to Both Sides of the Conversation Live. We meet here on scheduled Sundays at 2 p.m. Be sure to check our Instagram page and our YouTube page for our upcoming shows. I'm Brittany Doyle, founder of Wise Health and co-host on today's show. I would like to introduce you to the executive director and host of the show, John Henry.
Good afternoon, everybody. Welcome to Both Sides of the Conversation. Today is our Sunday conversation. I know it's been a while since we moved our third Sunday conversation, but today is going to be a very, very important conversation for a community. When we talk about Ask a Black Doctor, we are talking COVID for a town hall series. Great information, great sponsors and doctors here to talk about some of the questions that our community have. And I hope today you find this conversation useful and meaningful. And I think they're going to give us some great information, and hopefully we can get some people to think and with the right information. So with that being said, it's been a long, long week coming out of this holiday season, Thanksgiving. I want to first say thank you to all of the community folks, families, friends who have been sending nothing but love and prayers to my family as I had to take another loss of a family member, my uncle, over the holiday weekend. So I just want to say I appreciate community for supporting, uplift me and my family, keeping me going during this time. It's been a struggle. As you all know, earlier 2 months ago, I lost my mom. It just seems like they say it comes in three. We've been getting hit with it, but thanks for all of the community folks who have just continued to pour love into me and the family. And I know it's been tough for a lot of community folks who've been reaching out, dealing with loss. There's been a number of incidents that have taken place in our community over the number of past weeks here. And we just want everybody to know that it's love, peace in the air. Stay strong, stay committed, and keep uplifting and supporting, encouraging folks, and reach out to your community loved ones and make sure that they are doing fine during this holiday season. Thanksgiving past, we are getting close to Kwanzaa and Christmas and New Year's. And for people who have lost loved ones, sometimes this time is challenging. It can be depressing, and people can deal with a lot of things that we may don't know. So please reach out and show some love to the community folks out there and check on your loved ones. So with that being said, I know last week a lot of people was reaching out what's happening due to COVID and some travel restrictions. We lost our hidden gem guest last week, and then Thursday our guest got sick. So everybody was just like, it's just been one of those weeks. The energy has just been going around, and we're trying to bring it back positively. I know on our website, people have been reaching out. We're in a transition. We have a new website that is launching. So hang in there. Our team and our website designer is almost getting complete. We had a few hiccups. We was trying to have it launch for Giving Tuesday, but it is coming shortly. We are getting close, and we'll keep everybody updated on that information for the new website. Should be very, very nice and easier more complex, but easier for people to navigate. So looking forward to that. We're going to move on to our community announcements, as well as our world announcements today as we get ready for today's show. The NAACP is recognizing Black teachers who phonics workbooks improve reading skills in 30 days. This is some phenomenal information. After more than 30 years of teaching, Sister Rosa Higgs out of Baby Hunters Point has been recognized by the NAAC, the branch in Berkeley. She has been volunteering to help students in Berkeley and across the Bay Area and during the pandemic on bringing up reading levels. And I guess the work that she is doing is just impacting so many students. She teaches students to read beyond their grade level within 40 hours or less. I think that is very, very cool to have a teacher who can increase reading skills for our young folks in that amount of time. Very, very important stuff. Also, a new variant is Omicron is out. I hope I pronounced it right, but we have a new variant. We also had a sighting of it, or one of the registered researchers at UCSF said that it came to San Francisco. We know it spread through New York, Georgia, Pennsylvania. So again, this conversation is very important today as more and more variants are coming out, and we want to make sure that our community is protected and doing the things that we need to do to fight against this. So very important information. Community announcements. Just want to give out a couple of shout outs. So everyone who don't know, East Oakland Collective and both sides of the conversation has partnered on the toy drive. We're still having drop-off items happening Monday, Wednesdays, and Fridays, 10 a.m. to 2 p.m. at 7800 MacArthur Boulevard. We are getting close, but we still need some donations to meet our numbers. But we want to thank the Oakland Teacher Association, the Aura Stream LLC, and Vibes and Smiles for supporting the toy drive. We have been getting an abundance of stuff in to help our unhoused folks and some of our families. So we want to give them a huge shout out for stepping up. We still have a couple of weeks here before these holidays. As you know, with the financial crisis that is happening in our country right now, families are being impacted financially. So all of this community support for toys for our young people during this holiday season is much needed, as well as we are approaching these colder days in this winter, helping our unhoused brothers and sisters with blankets and clothes and jackets. I want to say thank you to all of the local donating folks who just been dropping off blankets and tents and just things for our unhoused folks. Please have the humility and compassion for the people. It is a struggle out there for a lot of our folks. They are going to work, some of them, but still not having the resources that's needed to have housing. So all of those donations are very important, and we're getting this stuff out to the community, to our unhoused folks every day. So just want to thank you. Also, there's a big diaper giveaway. We are still receiving information from folks who need diapers. We do have a nice selection of diapers out there. So please reach out to both sides of the conversation, our East Oakland Collective. If you have diaper needs for the community, we know a lot of our single mothers are looking for that type of support. We have some packaging for you all. So please reach out to us so we can get that stuff to you all. The Indian Basin Shoreline is happening every Wednesday and Friday. If you like to get organic groceries while supplies last, please check them out every Wednesday and Friday, 11 a.m. to 3 p.m. They have hot, healthy meals as well. And I know Rafiki Coalition is a big part of behind that as well. So please come out and get your support at the Indian Basin Shoreline Mondays and Wednesdays. We got a couple of events that's coming up for the holidays. Jingle All the Way is going to be happening at the Bayview Opera House Saturday, December 18th from 12 to 5 p.m. They're going to have some live performances by some local Bay Area artists and a number of vendors and folks that's going to be out there supporting that event. So looking forward to seeing that event. Hope to see you all out at that event as well. And then also Shug is having a Shug Christmas to remember, live entertainment, vendors, great food. They're going to have a silent auction. So looking forward to Shug event. We'll be getting that out on our social media handles, making sure that community gets it. Also, Maurice Rivers and OMI, they are having a Kwanzaa thing that's going to be taking place on the 18th as well. We'll be getting those flyers and information out to community. And for all of our community folks that have been asking questions, how do we get these announcements out there for the community? Please go to our website, both sides of the conversation. You can email us at bsotc at events, And all your event information, if you want us to get it out to the community, you have to put it there. We get it out on our calendar and get it out on our newsletter as well. The Sugar event will be happening at the Cafe Envy on the 19th from 1 p.m. to 5 p.m. just so everybody that's looking for that location. We'll have it up on the screen shortly here as well. Upcoming Sunday conversations and things that's going on with both sides of the conversation is Tuesday. We'll have our Hidden Gem segment, as well as we'll have our Educational Thursday presentation next week. For all of you that are still looking, I know Giving Tuesday passed, still looking, how do we support? We have an Amazon Smile account. Every time you purchase on Amazon, you could go ahead and choose both sides of the conversation as one of the organizations you would like to help support. And a purchase, part of that purchase that you do on Amazon will come to help support the information that we doing here at both sides of the conversation. Upcoming Sunday conversation, we're going to have Ask Your Black Doctor on December 13th. We'll have that coming up for you next week. And then on December 19th, we're going to have the doulas and midwives conversations. This should be a powerful conversation for community, as both sides of the conversation are working with different organizations, doing these partnerships. We're going to have a lot of things coming down the pipeline with Rafiki Coalition and Wellness as we continue to tackle the Black health issues that are impacting our community. We know COVID is one of the main issues that we are faced with right now, but we also don't want our community to forget that there is a number of mental health issues. There's HIV, STI issues, and there's other health issues that are impacting our community that are not being addressed or talked about as much because of this COVID. But we want to make sure that we bring that to the light, bring it to the forefront, and make sure that our community gets the resources that's needed. And part of that is going to be a number of things that we're going after as well with Wise Health, bringing these pop-ups back to our community, bringing up pop-up testing sites and things of that nature. So we are looking forward to that as well. So with that being said, I'm going to go ahead and close my mouth because that is the end of the community announcements. We got the pop-up pregnancy village. I believe is the last one coming up as well. We'll get that information out to community. Please check our social media handles. That is where all the flyers and information that is needed, as well as updated on our website. With that being said, Ms. Brittany, go ahead and go over the identifying problems and educate our community as we go ahead and bring up today's phenomenal guest.
All right, thank you so much. I just have to circle back real quick and give a shout out to the Jingle All the Way event. You were talking about local artists coming, but it's Mac Mall that's coming. I've been a huge fan of Mac Mall growing up here in the Bay. So I just want to give a shout out to them for bringing Mac Mall to the community for a great event for the holidays. All right, so today, as you know, the topic is Ask a Black Doctor. Since the onset of the coronavirus pandemic, the nation's health inequities have become even more glaring, with millions of Americans of color, Black and Latino in particular, experiencing more severe illnesses and death due to COVID-19 than white Americans. And so when we talk about where the problem lies, of course, we have seen over the past almost 2 years, many problems that, come up within our communities, within our families, within our city government. We've seen all sorts of things. Both the New York Times and ProPublica have written about the impact of COVID-19, reporting that in states where Black communities make up only a relatively small portion of the population, nearly half, if not majority, of all the COVID-19 deaths are members of the Black community. So we're talking about disproportionality here. This is largely due to environmental, economic, and political factors that have compounded for generations, putting Black people at higher risk of chronic conditions that leave lungs weak and immune systems compromised. And this is, we're talking about what we see in our communities: asthma, heart disease, hypertension, and diabetes. Redlining and environmental racism, for example, have Black neighborhoods breathing some of Americans' dirtiest air, drinking contaminated water, and living in food deserts, which means that you're in a community where you do not have access to healthy quality food or just produce or just food, period. Black people account for 25% of those who have tested positive and 39% of the COVID-related deaths, while making up just 15% of the general population. So again, we're talking about disproportionality. COVID-19 is having a clearly disparate impact on the Black community. And we have a clear need for data to be disaggregated by race and ethnicity, in addition to resources focused on our most vulnerable communities. COVID-19 is not an equal opportunity virus. Indeed, it shines a spotlight on America's pandemic of inequality. Everything we know this far says the burden falls in low-income communities and communities of color, especially the Black community. So today we're going to be talking about, where we are in the city as a community. We're going to be talking about solutions. So right now, a possible solution is to look at the factors driving these disparities, which are the result of chronic inequities in the determinants of health, such as access to secure income, housing, education, and healthcare. There is cause for serious concern that these impacts of this pandemic on minority communities will only widen these gaps. And so what we're looking at in closing these gaps is equitable vaccine distribution, improvements in healthcare access, funding of public schools in the communities to allow safe return to in-class learning will all help narrow this gap. And we're also looking at strategies. We need effective strategies. We need elected officials to provide support for the frontline grassroots nonprofits responding in real time to the crisis and filling in gaps where the public and private sector cannot or will not serve families and individuals in the Black community. So we're going to leave it right there, and I just want to call to the table our panelists for today. We have Black doctors here to answer, our many questions. And so as I call your name, if you just tell us a little bit about yourself, and then we'll move forward to the next person. So we're going to go ahead and start with Dr. Ariel Frank.
Hi, everyone. Thanks for having me. My name is Ariel Franks. I'm a family doctor at San Francisco General Hospital. I also work at La Clinica in Oakland. I'm working with the San Francisco Health Network as the equity lead, specifically with the COVID-19 vaccination and trying to address disparity in administration of COVID-19 vaccines. And I'm also working with the Ask an Expert program, which is having doctors, primarily physicians of color, be available at different community events to provide in real life education about the vaccine, because we understand that there's a lot of reasons why people can be hesitant or nervous about the vaccine, and we just want to kind of meet people where they're at and chat with them. So it's an honor to be with you all here today, and thank you for having me.
Thank you so much for joining us. Next, we have Dr. Ian Mclaughlin.
Hi, thanks so much, Brittany, and thanks, John. I'm already exhausted with all the things that you mentioned that BSOTC is doing. That's amazing. Thanks for doing it, and I'm so sorry for the losses that you've had recently. And Brittany, again, thanks for that incredible analysis of how terrible these health inequities have been. That was really brilliant. I'm Ian Mclaughlin. I'm an emergency physician at Kaiser San Francisco. I went to college at Morehouse in Georgia, and then I did most of my training in New York City. But I've come home to the Bay Area. I've been here for the past 11 years, and I grew up here initially, going to Glide and other places. And at Kaiser Permanente, where I work in the emergency department, I have been really active with the disaster response. I've been doing disaster with the city of San Francisco and with Kaiser ever since Ebola. And in that same capacity of disasters with this pandemic, I've continued to do a lot of vaccine work. So I was the physician lead for the emergency physician response at the Moscone mass vaccination site. I've had both my vaccinations. I was in a vaccine trial for AstraZeneca even last year, and I've been boosted. So I am extremely excited to talk about this. Thank you for having me. And I can't wait to learn, as much as we can have more of this conversation. Thank you.
Yes, I am definitely looking forward to this conversation. Lastly, we would like to bring Dr. Monique Lassar, who we lovingly know as Dr. Mo.
Hey y'all, what's up community? So happy to see everybody and my health heroes, Brittany and John Henry. Really honored to be here today, and of course with Dr. Ariel Franks and Dr. Ian Mclaughlin, just honored. So I'm not an MD. My training is psychology, clinical psychology doctorate, and I I actually don't really practice. I'm running an agency, so I get to do some little things here and there with folks who are dealing with trauma. So I work a lot with folks who are in intense processes with having witnessed a crisis or something like that, and it triggering, bringing back up stuff from life, from childhood, from violence that they've witnessed, things like that. And so I get to do that in my kind of spare time. But my main thing is Rafiki Coalition, Executive Director. And we've been on the front lines since Dr. Kim Rhodes hollered at me way back at the beginning of the pandemic. So that's got to be 20 months now. And she said, hey, Mo, why don't we come and do vaccine, or at this point it was testing. Why don't we come and do testing in your parking lot? Let's have it be Black doctors. And so we got on it, and we got UCSF to get involved, and we got the Latino Task Force to show us kind of what they had done. And then we did United in Health out here in D10. And we got Hunters Point, Bayview, Potrero, all of our folks out in Sunnydale and Viz Valley. We got everybody to collaborate and really come together and kick in. And from that, we had learned a lot. And then we moved into, all of these other pieces of the pandemic. But what we're really noticing now is it's not just the pandemic, it's also food scarcity, and it's also mental health challenges. So the American Mental Health Association just posted a figure that was staggering. They said 50% of all Americans, this is all Americans, have been could be diagnosed if or have symptoms of mental health challenges right now, given isolation, the level of stress that everybody is under. So we really have to destigmatize and get folks the support that they need. So we're happy to have been adding Black therapists throughout the process of the pandemic. Also, we've added food because we know people are hungry, but we're still needing more resources for both the food and more resources for the therapists. But we also do have testing. And so we do testing, we do vaccine sites. And we've learned a lot from all of that. And so we're really grateful for all the partnerships across the city, from Department of Public Health, from Kaiser, from everyone. The city has been staggering in the support of all the CBOs. Everybody has really just jumped up and said, let's support. And I want to give a special shout out to Director Dr. Cheryl Davis, who stepped out at the beginning and with the support of Mayor Breed and Supervisor/President Walton really kicked in with the support for the community. So we couldn't do it without everyone. So I just want to say that this has been a tremendous collaborative, and we've got a lot more to go. But what we have learned through this process is that Kuja Chakalia, self-determination, we got to do it for ourselves, by ourselves. So we can get support from everyone, but we actually have to circle up as a Black community to kind of come together and do this. Otherwise, with the overdoses, with food scarcity, with jobs, with mental health, with COVID, everything that folks are dealing with, we can't do it. We can't wait for the city to remember us in this process. So not throwing shade, just keeping it real. So really happy and honored to be here, and super excited to kick off this partnership with both sides of the conversation. Really have been blessed with all the work that John Henry has been doing, and with Brittany and everyone else. So thank you. And I look forward to kind of kicking it off in a minute.
Wow, powerful stuff. Thank you, Dr. Mo. And we appreciate all the community organizations who have been working together. And we know so many times in our community, we hear that organizations are not working together and they're not doing the things to impact the community, but the pop-up sites, the things that are happening, the vaccination sites, the testing sites, and a lot of the stuff that we are doing to work together is very, very important. So we just appreciate you all staying open and ready to do this type of work. It is a Sunday. We have doctors here on a Sunday. Very important stuff. Community, you want to ask a Black doctor? We have some Black doctors here. Our community is very, very when it comes to having people who look like us for information, sometimes is what is needed, our Black and brown community, for whatever reason. But today you have it. I know today's conversation is about the vaccination and, our young people. A lot of households are dealing with, do I make the decision to vaccinate my young folks? So I know Dr. Ian is going to have a brief presentation, but community, if you have questions, start bringing them in through the chats. Please, if you're on our YouTube channel, go to the live chat function, put your questions in there, and we'll get them up here for our professional folks here to answer. As well, if you're on our Facebook page, you can put the comments up there and we'll get them on to the screen. But with that being said, Dr. Mo, we're going to turn it over to you and the team to kick off today's conversation.
Wonderful. What I wanted to say is ask the questions that you don't even, these are the questions that you don't get answered if you're embarrassed to ask. These are the questions you can ask them confidentially in the chat, because this is the time where, for me, and just to be keeping it real, so vaccinated twice, right? And flu shot. So that's another piece to talk about. But I was really nervous at first with the vaccine. And finally, and one of the reasons why I was nervous is because I have allergic reactions to different types of medication. So I was like, oh my God, I'm going to die, right? I'm going to have anaphylactic shock. And so I asked like 5 different doctors, all my Black friends, my Black doctors, and they're like, no, you're going to be okay. And so actually one of the white doctors from DPH was like, okay, I'm going to sit here with you while you do it. I'm like, get your EpiPen ready. If you need to take me to the ER, you're going to take me to the ER. And, but that gave me the confidence to go do it. And this is what I want, y'all. This is life-saving for all of us. So if you need somebody to be with you, you need a ride, you need somebody to come to you. We have Umoja Health, who has the Umoja Health van. We can bring it out to you if you're housebound. Like, we're going to get you vaxxed. And we're going to get you back vaxxed because this is what we know saves lives. So I just wanted to give that shout out. And I want to kick it over to Dr. Ian Mclaughlin, who super, super excited to get to know and form this beautiful collaboration with. So Dr. Ian.
Hey, yes. Well, maybe we can just, repeat Brittany's really amazing numbers. Can I get to the slides?
Yeah, go ahead. If you want to go ahead and share
your. Have access to that?
Yeah, when you logged off, it kicked you off. But go ahead and reshare them, and then we'll put it back up there. Just resubmit your.
Oh, okay.
And while you're doing that, Brittany, if you want to go over those numbers again, you can.
Do you see my screen?
Yep. Your slides is up. They're up.
Okay, I can repeat.
So
okay, go ahead.
Well, yeah. So and I think that Dr. Franks was also kind of making sure that we would emphasize this. So please, jump in. But I think just to orient us, the COVID has been really 2 years that have been incredibly difficult. You remember that at the beginning, I trained in New York, and at the beginning, all the hospitals had large trucks outside, that were refrigerators to hold people who might pass away and not make it to the hospital in time. So we've definitely had to surge, not just the treatment, and not just the hospitalizations, but also to deal with the very unfortunate deaths that have happened from COVID. So across the world, we've had over 300 million cases of COVID. There have been over 5 million deaths. And luckily, there's been over 8 billion vaccinations so far. Then just, more here in the US, to look a little bit more closely, I don't think I have a slide of that, but in the US, I think we have, I think it's like 49 million cases of COVID that we've had, and over 750,000 deaths in the US of COVID. So it's a lot of deaths that are still happening. And then we also kind of wanted to talk a little bit about pediatrics, right? So when we think about these kids, these new, indications for vaccination for kids that are age 5 to 11, that's 28 million kids that are age 5 to 11. 2 million of them have already had COVID, like documented, confirmed cases of COVID. We think that probably 1 in 3 kids of this age group have already had COVID, 1 in 3. And then still, more than 8,000 of these kids have had to be hospitalized for COVID. There's long-term complications, many thousands of them are happening. And clearly, even for kids, that we used to think that kids were protected from COVID, that now now COVID is one of the top 10 reasons for death in this age group from 5 to 11. One of the top 10 reasons of death. So yes, this is an incredible problem that we are still attacking, still fighting, and it looks like we're winning. And I think it looks like the real hero in this has been the vaccinations that over 8 billion people have had across the world. Many millions of people have had in the United States. I think it's over 200 million at this point. And with that, we have a lot of experience with this vaccine, and it's saved many millions of lives around the world. There are some side effects which are really, really rare. The most dangerous one would be the one that Dr. Mo was talking about, of anaphylaxis. It's far less than 1%. And more likely, you're just having these small reactions that you would get with any other kind of shot, where you could get some itchiness, you can get some local reaction. So those things are more common, but not nearly as concerning as the overwhelming disaster of the pandemic. That's it. Dr. Mo?
Oh yeah,
John?
so Dr. Ian, I just wanted to, sorry, I was kind of going to the questions, and there was a question from Betty from the Bay, and says, I recognize the importance of having my daughter vaccinated. My concern is that the possible long-term effects. What are the potential side effects of the vaccine in children?
So I'll put it up there on the screen, the question on the screen. We can't hear you, Dr.
Yeah. Sorry. Yeah, and Dr. Franks, you were mentioning about that with myocarditis and other things.
So at this point, we don't have reason to believe that there are very serious side effects, but understanding that the COVID-19 vaccine is very new, very, very new in this population. I believe in the original studies, about 3,000 kids aged 5 to 11 were participating, and it might take 1 million people getting the vaccine before we see the really rare or more dangerous complications. I just kind of want to emphasize that the COVID-19 vaccine is just like very, very similar to all the other vaccines that we have been doing for many, many years. So just like we have been doing vaccines for polio and measles and flu, the COVID-19 vaccine is made up of a lot of the same things. And so there's no reason to believe that there's going to be long-term effects on fertility or on overall health. But that said, I know that a lot of parents are hesitant because it is brand new, and measles vaccines have been around for 50 years. But I wholeheartedly believe that the risk of COVID is so much greater than any possible risk of the vaccine, and that it's much more likely to get some of the serious complications that we've seen with the vaccine from actually getting COVID-19 infection. Reassuringly, so some people might have heard that young people, men particularly, ages 12 and older, were having higher rates of something called myocarditis, which is inflammation around the heart, which is a very scary sounding thing. But all of the people that had this recovered very, very quickly, and ends up being less than 1 in a million youth getting this. But since the dose of the COVID-19 vaccine is lower for ages 5 to 11, thus far, thank goodness, we have not seen that side effect. But unfortunately, the only way we will really 100% be able to promise that there's no long-term effects is time. But it does seem urgent that with the COVID-19 virus mutating and becoming stronger and getting past our defenses, that the best way to protect against that is to vaccinate, and to vaccinate as soon as possible.
Wow,
Thanks for that, Dr. Franks. That was amazing. Yeah, and the other thing was also that quite terribly, the effects of COVID are so much higher in terms of, especially with myocarditis. So the problem is that natural infection is a bad strategy, and in San Francisco, we've already decided that, to just allow people to get infected with COVID without these precautions, we believe that this is racist, that it disproportionately affects Black and Brown communities. So Dr. Tommaso Aragon, who was our health officer in San Francisco, made a really strong plea that we would, not allow a policy of natural infection, which was, what the Trump administration was seeming to encourage. So, quite certainly, if that had been the strategy, many more Black and Brown people would have died, many more side effects, including things like the multisystem inflammatory disease, where there's chronic complications from COVID. Thank you.
And another question I see is, it's safe for you to get the vaccine and the flu shot at the same time?
Yeah, we recommend getting both. It's a twofer.
And then, I had a good
there
question.
used to be a lot of concerns. Yeah.
No, go ahead. I didn't hear you cut off. Go ahead, doctor.
There used to be a lot of concerns about having COVID vaccination with other vaccinations, and initially we would not allow both vaccines to happen within a 2-week period. The flu vaccine we usually said was okay, and even in the original trials, you're allowed to do both the flu vaccine and the COVID vaccine. For all the COVID vaccines, they usually were allowing both. And initially, when we introduced it, in this country, it was not allowed. But over the past, I would say, more than 3 months, we've been definitely giving more, as many of the vaccines as possible to make sure that all the preventive care that people really need is happening. Of course, right now, the most important preventive thing would be the COVID vaccination. But yes, it's definitely okay to mix.
Well, I have a quick question for parents out there who might have. I have my granddaughter 5 years old. I was waiting for today's conversation before I make a decision on letting her go. Because the young kids, they don't like to get the shots. How close are we from the oral? I know they said they have the oral pill that they are giving out. How close are they at for the young folks to, take the pills and that nature instead of having to get in the shot? Are we close to there, or is still more research being done?
I do not believe we're close. In fact, most of what I've heard is only a pill for treatment for COVID-19 after you get it. I have not yet heard anything about a oral vaccination, and I apologize if I'm out of date, and that is something that is out there on the news, and I just haven't come across it yet. But I would say that preventing someone from getting COVID-19 is so much better than having to treat it after they have it, because it's so, unfortunately, it's often random who is going to get severely ill from COVID. For the most part, it's people who are older or have comorbidities, but tragically, we have had really young, healthy people die from COVID. And for that reason, my goal would be for no one to get it in the first place and not to be treating it after the fact. And I've only heard about the pill, and whatever pill I've heard of has only been approved for, or they're only testing it for older people. They have not been testing it for younger people.
Yes, I would agree. There's, I think in Cuba, they have an oral vaccine that they recently introduced. It is not approved by the World Health Organization. In the meantime, exactly like Dr. Franks was saying, it's a pill for treatment. But with these vaccine trials, just like Dr. Franks was saying before, the initial vaccine trials were done with 40,000 people. Now it's 8 billion people have received vaccine. It's newer for children, but it definitely is effective. And typically, in the emergency department, as long as I have an iPhone for a kid, I can set their broken bones. I can put in stitches with numbing medicine. It's amazing how well an iPhone can distract a kid from the shot.
And kids are incredibly resilient. It's just, I'm amazed by how brave and wonderful children are. And there's, I'm not trying to minimize the trauma or difficulty of getting a shot, but things that parents can do to, or caregivers can do to make it less of a scary experience is to, be there with them, do things that they like, hold their hand, promise, a treat or something afterwards, but really emphasizing how brave they're being and how proud you are of them, and letting them know that what they're doing is protecting them as well as their family members and the community, and just letting them know that what they're doing is really, really brave, and that real positive reinforcement, which isn't a lie, it's true, and it's making it safer for them to see their older relatives. And most kids I've seen actually are within 30 minutes running around, aren't having the same terrible, side effects and feeling sick for a couple of days, and have just had this huge smile on their face after getting it. And so just to really encourage that it does seem that kids are bouncing back a lot faster than the rest of us.
Yeah, that's what we're seeing at the testing and the vac sites as well at 1800 Oakdale. We're seeing the kids up, bouncing around, ready to play right after. So don't be afraid to think that the kid is gonna get hurt. And like a lot of us, we had our sore arm and we had side effects for days. That's not happening with the kids for the most part. So just know that kids are, as Dr. Frank said, very resilient. And they also want to be able to go play. One of the biggest things that we saw is that kids want to be able to play with their friends, and they also want to be able to play sports. So if they can't play sports often if they don't have the vaccine. So this helps them get more access to doing more things. So that's one of the things that the parents have used to get folks vaccinated. So I see a question from the East Oakland Collective. If I got the Moderna vaccination, should I get the Moderna booster as well? Or is it safe to get a booster on the other brand? So I'm going to give you the response from Dr. Kim Rhodes, and then I'm going to pass it over to you, Dr. Ian and Dr. Ariel. Dr. Kim Rhodes said, it's kind of like strength training, right? You don't strength train on just your arms, you strength train on your arms, but then you also you do another form on your legs. So when you have the two vaccines, it's basically covering you doubly. And so you're getting the benefits of both. And what we've seen from the slides that Dr. Kim shared with us this last Wednesday at our Ask Your Black Doctor Town Hall, she said essentially anything with Moderna has been positive. So it makes the efficacy much higher. So one of the things that I was concerned about, and I do want us to talk a little bit about, is J&J before we get to the end, because I'm actually very concerned about how J&J was marketed to Black folks, and it was really unethical. And we have a lot of our seniors who have J&J. So I'll get back to that in a minute. I want to have y'all give your weigh in on the double vaccines and how to do that.
Before they go, Dr. Mo, I think that's a great point that you bring that up, because I think that is some of the struggle that community had. Once they started finding out some of the problems that J&J had, it made our community real resistant, right, to the other ones. And I know some of these questions are going to come in because I've had some of the families ask, what for the young folks, which vaccination do I give them? Is it Moderna? Is it Pfizer? Like, what's the best option? So
with the young folks, you don't have a choice. So you have to the Pfizer is the only vaccine that's approved. So you're already, that's the bottom line. But with the other ones, I'm gonna have the MDs holler. My critique is around with J&J is around the marketing, is around this, frankly, the racism. And the way that it was also marketed around poor communities. So I'll get back into that in a minute, but I want to pass it to the MDs.
I can start on that, and I'll be super interested to hear Dr. Frank's thoughts, especially with the San Francisco Health Network. But I think the first thing I definitely want to emphasize is that there has definitely been a learning curve. This is a new pandemic, and we're all learning sort of some of these things together. And the strategy that San Francisco had, the strategy that the U.S. had, began with an incredible optimism of having a single vaccine, one shot, does it all, and protects people for life. We wanted a vaccine that was just, one shot and lifetime protection, 100% perfect efficacy, and zero side effects. That's the goal. So in many respects, the Johnson & Johnson vaccine came closest to that goal in the beginning. In particular, especially here in San Francisco, our goal was to make sure that we could outreach to as many people as possible, especially the hard to reach communities. So for anyone that may be a little bit more distanced from the healthcare system, we really wanted to make sure we didn't miss them. So the idea of trying to get those kind of communities to return in 21 days when they may not already have a primary care doctor, they may not, be able to control their schedule because they are, an essential worker. For these reasons, logistically, it would be much more important to get as many people vaccinated as possible than to have to worry about that second dose. So the Johnson & Johnson was a dream that worked well, but it didn't work as well as the BioNTech and the Moderna, which Pfizer Moderna, we'll say. So that was stunning. That's shocking that we had such amazing high levels of efficacy and protection with those two mRNA vaccines. The Johnson & Johnson vaccine was used with technology that was a little bit more traditional, but the mRNA was also incorporated several advances in medicine. So in the initial studies all looked really, really good. Who would have known that in the real world scenario, the mRNA would outperform anything we would have ever imagined? So I think that there has been a definite adjustment to address the difference in the effectiveness of the Johnson & Johnson, by following it up with the mRNA vaccines. And I think that work is not always so easy to accomplish, except for organizations like Rafiki, to help us bring our arms around these groups so that we can really make sure that they are fully protected.
I just want to echo what Dr. Ian said, that I think that, yes, a lot of what we've learned has been due to time, and that things looked really great initially, and then it's with time and learning that we discovered that they weren't. So there were studies that showed Johnson & Johnson wasn't quite as effective, but we thought that that was because Johnson & Johnson was made later. So it was getting tested against variants, which were a little bit stronger than the original COVID. And so people did believe that it was just as good. It then came out with time, and once we saw that there were more complications with it, that it really just actually wasn't as good as the other vaccinations. And definitely want to echo what Dr. Mo said, that I think a lot of assumptions were unfortunately made by the medical community about what Black people would want, and that Black people would only want one shot, and oh, it's a name they know. And frankly, a lot of these assumptions were racist, and that Johnson & Johnson was being promoted to the Black communities, to people experiencing homelessness, to Latinx communities, because it was thought, oh, they're not going to want to come back. It turns out that actually many, many people have no issues coming back for their second shot, that we, are totally fine getting a second shot, and that was completely erroneous for that assumption to be made. And then with months and months passing, it turned out, oh yeah, Johnson & Johnson does need the second shot, just like the other ones. And not only does it need a second shot, it needs it within 2 months. And so I truly believe that the best shot, no matter what, is the one that you can get right away, and to get vaccinated and get boosted ASAP. So these details of should I get a Pfizer if I got a Moderna first, I don't really bother. I mean, I think it's true that they work just as well. I don't think there's evidence that they work better necessarily, but I say just get whatever shot is available, because the best thing is to get vaccinated as soon as possible. But my personal practice at this point is to really encourage my patients to get Moderna or Pfizer, just because of what we have seen with Johnson & Johnson needing a follow-up shot sooner, and because that it maybe wasn't quite as good as the other two. But any vaccine is better than no vaccine, and if there's one that's right around the corner from you that you can get for your booster, I say go ahead.
Yeah, and one of the things for us is that we also recognize that a lot of people are walking around and they don't realize if they got J&J, they don't realize that they're not protected anymore. And that's the dangerous part. So if you got your J&J back in May, June, July, after 2 months, you're not protected. And I see a lot of my loved ones walking around like they are protected, and they're not. So we really want folks to know that they have to get boosted. I'm not a lover of shots. I didn't used to get the flu shot. I got it last year because doctors were recommending it, because also I didn't want to be afraid. We didn't even have rapid tests then, so we didn't know if we were COVID positive. I didn't want to be afraid all the time that I had if I got the flu, I didn't want to be afraid I had COVID all the time. And also because I have to work. Like, I know for some folks, being quarantined for 2 weeks, and you can't go to work, is horrible. And so for me, running an agency, I wasn't able to really do that. So I wanted to be able to know. So I took my flu shot last year. I'm taking my flu and my booster this coming week. So I'll let y'all know next week how I'm feeling, what happened.
Now, I have a question. I wanted to go back to what you were saying about the shot not being effective after the J&J shot not being effective after 2 months.
Yes.
But isn't that the same for Pfizer too? Doesn't Pfizer lose effectiveness after 4?
6 months. Pfizer, as far as what I know, and the MDs can tell me something different. The efficacy wanes after 6 months with Pfizer and Moderna. So that's why we need to, especially for seniors, and Brittany, I know you do so much work with the seniors. We really want to make sure that they're getting it, because when they're, and that's when we thought with Delta, we were seeing all the breakthrough infections, and when in fact it was actually waning immunity. And so what we were seeing with a lot of the seniors is that if they get what we were calling breakthrough COVID, or their immunity had waned, they were being hospitalized. And so we want to keep them out of the hospital, because we know once you're in the hospital, you're exposed to so many other things as well. But it does bring me up with a couple of things that I do want to follow up with both sides of the conversation, which is, and Brittany, you also mentioned as well at the beginning, is because we've been focused so much on COVID, where a lot of folks are not getting their blood pressure screened, they're not getting their blood glucose screened, they're not going to the dentist, they're not doing all these other things that we know keep people healthy. They're not getting their cancer screenings, their mammograms, their everything. So we really got to make sure that, and also to the STD, STI testing and all of that as well. So we really have to make sure that folks are able to have accessible their medical institutions. And when we keep having COVID infections and COVID hospitalizations, we can't get to the rest of the stuff that we need. So we got to get COVID down so that we can use the doctors, and to that point as well. So that's another reason why I'm a fan of getting this under control, is because we had so many people die this year, and it's been really
thank you so
hard.
much. Yeah, and many of the deaths that happened this year, which is hundreds of thousands of Americans who've died, many of which were Black and brown. Unfortunately, many of these may have been preventable deaths from vaccine. That if people had been vaccinated, maybe these deaths wouldn't have happened, certainly not at the same rate. And then, Dr. Franks, did you want to talk about the waning?
Yeah, so it's waning immunity means basically the vaccine isn't working as well over time. And it's just so hard. There are some people get a COVID shot and they're still immune for 2 years. And there's other people who get a COVID shot and it doesn't work as well for them for 2 months. And we don't know just by living which one we are. It's random, and everybody is different, everybody. So that means that the CDC has kind of looked at the studies, looked at the antibody levels in people's bloods, and has come up with this average. And on average, it looks like, okay, if you got an mRNA shot, so that's Pfizer or Moderna, you should get your booster shot 6 months after your first shot. That doesn't mean that at 6 months your shot totally doesn't work anymore, but it means that you probably aren't quite as protected as you were back when you first got it. Because something I've heard too is that immunity, which means how protected you are, isn't a cliff. It's not like one day you're protected and one day you're not. Like it doesn't go off like this. It's more kind of like a slow slope. So to catch it, it's good to get vaccinated after about 6 months after your first set of shots. This is different from Johnson & Johnson, which it looks like that drop off is much quicker and is after 2 months. You really are not as protected, and that you really need to get another shot after 2 months. It's honestly not completely surprising, because we've seen that we need at least 2 shots for the other ones. So really maybe Johnson & Johnson was a little optimistic to think that it could do 1 shot. One question I get a lot too is, does this mean we're going to have boosters forever? Is it going to be just like the flu shot? We're going to need a COVID booster every year? It's just a little too soon to say. I do think it's possible, but I have also heard some reassuring data that they do think that maybe after 3 shots, that would be enough to keep the antibody levels high. I don't want to promise anything. I don't know, but it's just, again, emphasizing that this whole disease and the vaccines are so new that we're not sure yet. But that right now, the studies show that our immunity, our level of protection is going down slowly. And so we should boost it. We're not sure how long that boost will last, but that to keep us safe over the holidays and the next few weeks, the next few months, that if you got your mRNA shot 6 months ago, you should definitely get another shot. And if you got a Johnson & Johnson shot 2 months ago, you should get another shot.
I think also with that, it may have changed last week with what the CDC just changed with all adults from, now should get boosted. What we were also seeing previously was that there was waning for getting infected from with COVID, but not waning from dying from COVID. So, it may not be that we have to get, shots every 6 months forever. The long-term picture still looks better than that, and I think it's just also important that we complete the full vaccination series so that we can protect against death, which is, I think, probably the most compelling reason for vaccination.
I got a question, and I want to hear from the medical professionals because I think, you all hit on a very pressing topic. A couple, earlier when you was talking about, Dr. Mo was saying that hospitals were being impacted. How much have the messaging from a medical health perspective have we learned over during this COVID? Because I think the messaging has really been a problem with the communities and people being engaged. And then I seen some of the questions in the comments about when people homes are vaccinated, what happens if you miss that 6 month period? They say 6 months after Pfizer, can you still go get the booster after? Do you have to take the 2 shots again? I think that's one area that we really need to focus in on as well, because I know there was a lot of questions that community had. But I think the messaging thing is one area that I really want to hone in on because I think the mismessaging on top of just the historic and systemic issues that Black and brown folks have dealt with when it comes to the medical and our health has really impacted the community. And I think the sloganation of everybody trying to make these slogans, but I think the misinformation that I think have really did a disservice to our community is when we talk about the deaths of COVID and not really addressing the underlying health conditions. So many times there were underlying health conditions that actually caused the death with COVID. But I think when people were dying, the messaging that was coming out, another person died of COVID. And I remember there was a big topic on it when Colin Powell died. And it was like, well, he was battling, other health things, but because he caught COVID on top of those health issues, that was like, the pushing point. But how do we, are you all seeing, how do we present that information? And then I know, there's learning curves with all of this, but, have the medical people come to a point, and I know it's always a difficult thing when you're trying to navigate communication between federal, state, CDC, local, right? How do we get to a point where that messaging is more consistent? And if that means we just have to be a little bit patient on getting it out to the community, maybe it's an internal for the medical folk before it comes to the community, because I know in the Black community, that was a big issue. One day the CDC is saying this, the San Francisco Public Health is saying this, the hospital is saying this, and then, something would change. dramatically through the CDC that really impacted the community. And I mean, that really put up a barrier on people like, wait, you know, 1 week they saying this, now this week is this, you know, how do we fix that? Is that something that you all see from behind the scenes, you know, from a medical standpoint? I know it's always hard when you interloop in federal, state, and local, but I think that's an area that they really, out of this pandemic, I hope they really clean up to really help people decisions and the way we communicate. And not just trying to be the hot news topic to get the breaking news out.
I think, thank you, John Henry, for drawing attention to this. And I think, and I feel like I'm sorry if I sound like a broken record, but it's just been because this is so new and because new information is coming in every day, it's been hard for the medical community to know because the medical system is patriarchal, perpetuates systemic racism and violence against brown bodies, and is used to being this like, this is the answer and this is what we do. It's been very difficult for the medical community at large to kind of take the more humble, appropriate stance, which is what I do try to do, which is I'm not totally sure. I can give you the information I have right now, and I want to be honest that the information might change. What I don't know is if I'm actually ticking my patients off by being honest about this, because sometimes people want just a clear answer and banging my fist down and saying, this is what you should do. That's not my personal style, but unfortunately that is the style of many of my colleagues. And I think that's what we're really struggling with, that we are in a very unknown space where the information is changing constantly. And I too feel the frustration that my higher ups one day are saying only give a booster shot if somebody has diabetes or other comorbidities. And then it changed literally a week later. Anyone over 18 can get a booster shot. And that's really frustrating. And when Black and brown communities have a lot of reasons to be hesitant about what the medical system is saying anyway, it's not instilling trust. And it's really, really hard to be the message person. Another thing about messaging that is true at this point is that the people most at risk for getting severe COVID-19 are people who are not vaccinated. Mm-hmm. And at some points, and in many parts of the country, the least vaccinated groups in the country were Black and brown people. And I think a huge disservice that happened was, instead of empathy and sympathy and mobilization of resources, it's turned into blame. Like, yes, it's Black and brown people's fault that COVID's still here, yes, which is absolutely not true. It's the medical community's fault, yes, for all of the harms that we've committed, for Tuskegee, for Henrietta Lacks, for all of the racism that has happened, that people are hesitant. And so it's our job to build trust and address people's very legitimate fears. Also, right now in San Francisco, the least vaccinated group is actually white people.
Yeah, that's what I was just going to say. White folks, anti-vaxxers, the white folks that are the least vaccinated.
And if we were going to be using stigmatizing language talking about Black people, we absolutely, then we should be blaming, if we're going to blame anyone, the people who don't have the same legitimate reasons, the history of trauma, the history of mistreatment for not getting a vaccine. So I think, there's a lot there. Part of the issue is that most the medical community is white and from high socioeconomic status, and that's changing. And we are getting a voice, and we are having more Black and brown people advocate. And there's many white providers who are out there and realize these historical harms and are working to fix it. So the messaging is changing, but I do just want to apologize on behalf of the whole system for the complete missteps that have happened every step along the way. But I do think at the heart of it is this issue of wanting to seem confident and secure, but in a situation where there is no certainty, and that information takes time to come together.
Well, and I
just wanted to add on to what Dr. Franks was saying, in that at some point we can't always, even though a lot of the information comes from the medical community, but we do have like community health educators, health advocates, organizations that are actually funded to change the narrative for our communities. And so, we have to look to them as well to, implement those flyers with Black faces on it, to get out into the community and implement programs that are culturally relevant, to get people out, to come out and understand why they're getting, vaccinated, why they're getting tested, But I think that, although we're looking at the medical community, our actual community also plays a role in getting that messaging out as well. In San Francisco, we've put together task force, all sorts of groups, all sorts of levels, every single thing that we could possibly think of. Like you say, Dr. Franks, every day is a brand new day in this pandemic. We're learning something new every single day. So it's always going to be changing. But, as long as we stick within our network, as long as we be transparent, and what's going on, and keeping our community educated and informed, I think that we're moving in the right direction. And even though when we talk about COVID, it kind of has a negative tone on it, but San Francisco was real unique. Like, you can't really say too much negative when you talk about San Francisco, because we were on top of the game for every single thing possible. We were the first to receive everything, like everything we got: information, vaccines, tests, masks, everything. San Francisco was very unique than other communities across the country. And I've traveled across the country throughout this pandemic, and I've been to like different Black communities, and each community is very different. Like, San Francisco is unique because we talk about medical mistrust. We don't trust nobody in our communities. But if we go to the South, and we go to Memphis, where it's like majority of the African Americans are vaccinated, but you're still dealing with, low vaccination rates because they don't have access to vaccines. So it's different, what I'm saying, in different communities, because in the South, you have all Black doctors. All communities have a Black doctor that you can go to and talk to, probably more Black doctors than white doctors. And so, the conversation of mistrust isn't really the same in certain communities. But I just want to put that out there too, that San Francisco definitely has been unique. And we have been real creative and innovative in what it is that we bring to the table for our community.
Brittany, that's an awesome point. That was Brittany, right? Was that Brittany?
Yeah, that's Brittany.
It was.
Yeah, that's an amazing point. I'm so glad you mentioned that. And to take a step back to John's point about the messaging, and like, I think I agree with what Dr. Franks was saying, that things change so quickly, and we do want to. There is a race to get the information to people. And then also, what I've been amazed with, obviously, look at this chat, look at these comments, is that the questions are super sophisticated. These are not like simple answers, simple questions that are being asked. Like, people are asking questions about the molecular biology, the genetics, the immunology, the vaccinology. Like, these are incredible, like, very different spheres of medicine that we're trying to put into one little answer. So I'm amazed at how sophisticated the community is. And I think I want to also honor that and like sort of call that out as, part of the messaging is that who knew the questions would be this amazing. And then, to your point, Brittany, I definitely want to ask the question. I actually wanted to show the slide of this about San Francisco's vaccination rate by ethnicity.
I'll pull up the slides. I'll pull up the slides for you right there. They up.
Oh, you did? Okay, good. Yeah. So maybe the slide is too busy. You can't really see, but it just shows that, African Americans are really doing amazing in San Francisco for vaccination, especially compared to the South, which is kind of, shocking given there's probably many more African American doctors. And I want to ask Brittany, I want to ask the community, well, why is this? Why is it that San Francisco has been so successful for African American vaccination? Does this have to do with, amazing Black women leaders like Mayor Breed? Does it have to do with the way that she has navigated the pandemic, the way that she has created the relationship with the hospitals and the doctors and the scientists, the resources that we have here, in a way that, other leaders across the country have not, including the president at the time? So I guess I did want to ask, Brittany, that's an amazing point of how successful we've been. Like, what's your impression of where that came from? Or anyone?
Go ahead, Dr.
Yeah, I just want to say, I think it's thanks to our community-based organizations like Rafiki, Moja Health, both sides of the communication, Farmer Brown. Oh, sorry. It's because of our incredible community-based organizations and the on-the-ground grassroots work. And to thank everyone leading this session today, but that's what really sets us apart. And it's exactly like Brittany said, having community health workers and community residents going out, knocking door to door and educating people. And it just shows that doctors are helpful, but it's really because of the organizations that we have different rates. And having a Black mayor is huge, and London Breed is great, but that yeah, it's thanks to everyone leading this conversation. So thank you.
And I was gonna say too, it's everything that was just said, as well as projects like Wise Health that Brittany runs, and the work that the Human Rights Commission. I mean, I really can't say it enough. Dr. Davis now stepped in a big old empty space that was happening in the city. We were all in shelter in place, and she got us all together. So that was the step one. I think the other step is that because we had the HIV and AIDS pandemic in San Francisco, ground zero, we were able to use all that information. So all of the docs, a lot of the docs that I know that have been doing this work were our epidemiologists, and also were around in the early HIV and AIDS work, and so they know the strategies. And so we were able to hop, skip, and a jump, translate what we knew into the work. And so I think that that's where I will give also San Francisco tremendous credit. Of course, Mayor Breed, of course, the supervisors, of course, all those things, and of course, community-based agencies. But it has taken everyone. I mean, John Henry and I and others who were in all of the. I think the thing that we forget is that we are not only fighting the pandemic of COVID, we're fighting the pandemic of anti-Black racism, and that has been parallel to this the whole time. And so some of what we've dealt with too is just all the stuff that we were able to do with some of the HRC and defund the police work, and the Dream Keepers initiative, is that because of all of that work, we were also able to work together. Now, of course, we still have some challenges in our community working together, but I also say that what we're also claiming is that we're going to stay in the conversation and continue to have the conversation and not run away from it, which is, John Henry, I give you all props in this space to say, we are here. We love our community. We want to create a positive space. This is the space to have conversation, and we're going to bring these conversations to our community because we have to figure out how to work together. And, unfortunately, because of the plantation politics of San Francisco at times and being defunded, literally the Black CDOs at maybe 2% of the city's funding on out of all of the funding goes to Black agencies. Same thing with foundations and not and giving in that way, is that if Black agencies are not funded, then it's very hard for us to really give everything. But we still do, because we always have that motto of make a way where there's no way. But at the same time, it encourages that house and field kind of conversation of who's got what, who's got the good hair, who's brown, who's Black, who's not Black, who's this, who's that, all those conversations versus the thing that matters, who's showing up and doing the work. And so we got to have those conversations. Who's showing up and loving, who's showing up and putting others on. That's what I want to see in our community. And that's the way that I continue to roll. And I want us all to be able to roll like that. So I'm just keeping it real. Like, we have done tremendous work, Brittany, and you are so right. And I also want to big up San Francisco Black Wall Street and my sisters in that project as well, because and others that have stepped in. Our brothers, John Henry and other brothers that have stepped in to really do this community-based work, because it takes the village. We don't all need to be in the spotlight all the time. Like, we can just be on the ground, like, hey, I got you, Dr. Ian, give me a vax.
Right.
Hey, fix a plate. So we got all those different things, right? Ariel, so humble, all the time. Brittany's making these phenomenal, Instagram flyers all the time with all the information. John Henry's getting information out to the people. That's what I want to see, right? This is how we do it, is village and people and family coming together. So I think that we're just translating that, right? We're remembering what our ancestors did. We're remembering what happened prior to desegregation, which is that we had it all in the community, and we did it all here in the community. We didn't have to go out. And so we're just kind of finding our way back to that, is what I want to say as well. So I know I went off COVID.
I wanted to add to that. as well, Dr. Mo and Dr. Ian, to answer your question, like one thing that a lot of people I think may have overlooked was like the power of food distribution. Because immediately, like when we went into shelter in place, like, instantly with San Francisco having so many food deserts, the first emergency response was food distribution. Like I know I kicked mine off like the beginning of early March, just reaching like socially isolated seniors. And so just having access to those 300 seniors, building my trust, constantly in communication. When it came down for testing, guess who came down off the hill to the testing sites? My seniors. When it comes down to vaccinations, guess who's coming up? My seniors, because I have that relationship and rapport. Our food distribution efforts across the city was like something I'd never seen. I mean, I would go up to a doorstep of a senior and it'd be like 4 other people, with bags, coming to that same door, because everybody was networked to reach their community, who they have those relationships with. And a lot of African Americans in San Francisco were actually reached by some organization at some point, whether it was food distribution, mass distribution. So having those connections, maintaining those relationships, I think that also helped with us having those high numbers in vaccination because of our outreach efforts, because of our community collaborations. We were able to bring many more people. And like I said, San Francisco and our communities is very unique to what I've seen across the country. And I think that food distribution had a major role in our high efforts.
I just want to jump in there real quick. I have a couple things because my mind is always moving, but it's always in a good motion. But I want to bring it back to what Dr. Franks was talking about. And it starts with people like you, Dr. Franks and Dr. Ian, right? Being open, being transparent. I think so many times in the medical folks come to the community, they're not so transparent, right? And when we don't know, sometimes it's okay in our community just to say we don't know. And I think that's also helped change some of the things that's been impacting our folks to come get vaccinated. But one of the biggest things, that I do want to see, and I know Kaiser's doing a better job of it and other organizations are doing a better job of it. There was a big holdback in the Black community when it came to the education and awareness piece. And we understand that the doctors were overwhelmed with COVID at that peak when, people were working 12, 14 hours and exhausted. But one of the complaints that I heard from some of the leadership of some of these health organizations that was very disappointing to me was when it was time to come educate the Black community, they felt like they couldn't do it because they didn't have culturally appropriate doctors. So they felt like we didn't have enough Black doctors. So that's why we didn't engage with the Black community. And I think that's something that we need to change, right? At the end of the day, our community needs the information, right? And sometimes we're not going to get a Black face, but we don't want to let that hold us up from educating and bringing the awareness to our community. I think there was a gap. It was a period where we couldn't get the appropriate information because the thought process from some of these health organizations was, well, we don't have a Black doctor to go talk to these Black folks. And I think we need to change that. And I think it's starting to happen. And I think more of it is just having the right information. It doesn't matter the face, and I'm really good on trying to make sure our community gets that, right? Don't worry about the messenger. Get the message, right? And if we could just get confident folks, no matter what their background is, just to come give the right information. And when you don't know, just say you don't know, right? Because I think when we generalize and we do things, it always leaves this gray area open, and it really impacts the community. But to Dr. Ian's question about how did San Francisco do it before, you see Rafiki House, Rafiki Coalition here. You see Brittany and a different organization. It was courageous leadership. Okay, our mayor was the first city to shut down, right? So it starts with leadership, and we always talk about leadership here on this platform. It's about demonstrating what's possible. Our mayor took the J&J shot, right? Our president, Shaman Walton, went, out there and showed that he was getting a shot. I went out there and showed, hey, I was vaccinated, right? So I think, the movement part is the action part, demonstrating, right? Because they had their concerns and questions, but they said, for me to protect the community and let you all know as leaders and as our community folks, I'll take the vaccination to let you know it's going to be okay. And I think that was a big part of why so many of our Black residents were able to make that decision. It was a struggle. But when you started seeing the community leaders and the community organizations and the community folks getting their shot publicly, letting folks know I'm vaccinated, that helped it. And I think that was just great leadership from all of our organizations and as well as all of our leaders who took part of getting vaccinated and letting the community know that they were doing it. So I think that was the one thing that I honed in that I seen different than most cities and counties across this country.
And, one of the things I wanted to go back to really quick was what Dr. Frank said about the changing messages and not knowing. So this is the thing that I want to keep it real. Like, the Western medical paradigm loves to say it knows everything. It don't know nothing most of the time. What they often say is a good guess, right? But the medical white supremacist teaching tells you you're supposed to act like you know everything and that you're right, you're God, right? And so I think that one of the things when I work with my therapy students, my master's level counselors, is I'm often telling them, look, the client knows more than you know about their own experience. So listen to them, right? And so what I think Dr. Frank said, which is so important, is just listening and being humble. What I'll say again and again and again when I'm working with clients is that they need to know that I can be vulnerable. And this is different in a person who's doing counseling probably than a medical doctor, but they need to know that I can be vulnerable, that I have that I'm keeping it real about my own real lived authentic experience. And if I'm having questions about something, I tell them I'm having questions about something. If this is what I know right now, and this is the thing that I think is the best thing that's going to save their life, that's what I say. And it's not always the right thing. It's not always the politically correct thing when I'm working with my clients. But, a white doctor may not tell you, like, what the hell are you doing? Excuse my language. What the heck are you doing? You need to stop drinking. A white client's not going to necessarily tell, a white therapist is not going to necessarily tell a Black person, you got to stop. Like, I see you got to stop. Because they're trained differently. They're trained to say, oh, let me, unconditional positive regard and blah, blah, blah. It's your own life, all this and that. But when you're somebody who's from the community and you're looking at caring and loving your clients and your patients, then you say things like, you got to stop drinking. If you keep drinking, this is what I'm really worried is going to happen to you, and so you keep it real. You talk about your concerns, your care, your love for the community, which is different, I think, than a lot of the white supremacist training about boundaries and this and that and blah, 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 which is great, right? We have to have certain boundaries, but at the same time, if those boundaries are keeping us from keeping it real with our clients, then there's a problem. So I'm gonna.
And it's okay if you say hell, Dr. Bo. This is
okay.
Church
It's Sunday. This is a Sunday call.
We try to keep it as clean as possible. But again, when you talk about authenticity and you talk about being real, we try to keep it real here because we do try to let our other folks know. Like, sometimes in these conversations, it is going to get passionate. Sometimes it get colorful, but that's our people. And if you want to connect with those people, you have to be real. And if you're not going to be real, they're going to tune you off. That's just what it is, right? And sometimes they say, well, how come you get these people to connect, but I can't? Because you're not being real. If you can't say hell or you can't be real, our people go turn you off. Like, oh, you trying you something? I don't know. But as soon as you give them that authentic you, and they see that you are part of it and you understand, and I think what Dr. Ian said and Dr. Franks and what you said, Dr. Mo, and I think Brittany hit on it too, is vulnerability. In our community, we need people who look like us, who've been through it, to speak up. And too many times it doesn't happen. But I think the more people see us being vulnerable, saying, hey, this is what I'm going through, and I'm trying to do my part in the messaging. When I'm dealing with grief, and I'm telling my young folks, I go to grief counseling, I'm trying to get support, right? We have to start to be open because it's been a closed door for a long time. So we end up suffering in silence. And the only way we can open up to these conversations and to be brave is to have courageous folks like you all to come on and say the experience haven't been so great, but again, we've gone through the process and we walk on the side of you, and I think that opens the door for more and more people to start to listen and believe, and we can change that narrative. So I really appreciate that from you all today. But go ahead, Dr. Ian. Did you want to go through your slides? I still have them up if you want to go to it.
You know what? Well, I think maybe not necessarily, but to your point, John Henry, and to Dr. Mo and Dr. Franks, it's interesting, we have a situation in San Francisco where there are so many, like the current CEO for Kaiser is African-American, the former CEO of Kaiser is African-American, we have a Black mayor, we have all these community-based organizations that are also, Black, and still there is some distrust about, vaccines and these other education we're trying to give. I think some of this distrust is because there are unknowns. And I want to at least sort of also encourage or ask, that I think we still have enough information to make a good decision about vaccination. So even though there are many unknowns and information may change, there's a kernel of solid information that helps us make a decision that can really profoundly protect our community. And I kind of also want to emphasize that too. How does that sound?
Yeah, I thank you, Dr. McLaughlin, for that segue, because I did just want to, there's a couple of comments in the chat that I think are questions in chat that we haven't totally hit on. And so just to clearly state that there are so many unknowns. I am so tired of COVID. I know all of you are so tired of COVID, and that you all have done so much to keep our community safe. And we have COVID fatigue. And so I'm saying this, being honest, that the recommendations could change in 2 weeks, and that's frustrating. But what we do know right now is vaccination is the best way to prevent COVID-19 infection and to prevent serious COVID-19 infection. So a lot of times people say to me, why? Well, I don't want to get it because we're seeing people get COVID after they get vaccinated. But what we are seeing less of is people having to get hospitalized and die if they've been vaccinated, even though it is true that there are breakthrough infections. And part of the reason that's happening is because of the virus mutating and becoming stronger and evading our defenses. One question in the chat was, if all of my family members have been vaccinated, do we need to get boosters? I would say I do still recommend boosters for anyone who is 18 and up, who got the Pfizer or Moderna. I recommend getting a booster. And for anyone who got one shot of Johnson & Johnson, I recommend getting a booster after 2 months. It's okay to mix and match boosters. And I'm saying this with a little bit of a preference for, I would recommend getting Moderna or Pfizer. This isn't the official CDC line, but I do feel safe saying that I recommend getting Pfizer or Moderna over Johnson & Johnson at this point. And it's okay to get 3 Pfizers or 2 Pfizers and Moderna, or Moderna and Pfizer. Whatever you want to do is fine. It does look like they work just as well as long as you get a 3rd shot. And then if you got Johnson & Johnson, to get a shot after 2 months. And somebody asked what vaccinations are available for children. So Johnson & Johnson, Pfizer, and Moderna, or Johnson & Johnson and Moderna are only okay for people 18 and up. For people ages 5 to 18, the only vaccine that is available right now is Pfizer. And Pfizer has an adult dose for people who are 12 and up. And then the dose for people who are 5 to 11 is 1/3 of the dose. So it's a little bit less strong or less concentrated. But it's still for kids 5 to 11. They get 1 shot. I believe it's 3 weeks apart. So they get 2 shots total, 3 weeks apart. Just wanted to answer some of those questions in the chat, and please keep them coming.
That was great. Thank you.
I had another question that actually was just sent to me. And do any of you know anything about, will there be any changes in maybe, I guess it's like vaccination reporting? Like, will we have to show an update on the card? Have you heard anything about having to have new cards to show that, we're boosted, or anything around that? Proof of vaccination changes?
Go ahead. Yeah.
Yeah, not at this point. Only just, about a week or so ago, did the CDC change the recommendation from, that all adults should get vaccinated. But right now, it's really still just just to finish the full vaccine sequence, either 1 or 2 shots. But that is being pretty more deeply held to as an expectation.
Mandates are a very sensitive topic in general, and thus far I have not seen anything mandating getting a booster shot. And also just for mandates in general, I don't think that there's going to be any sort of mandating for children in San Francisco schools until at the earliest July 2022. In general, I feel very not great about mandates. While I am such a proponent of vaccines, I'm not a proponent of people getting forced to do things against their will. And I want people to feel comfortable and empowered to make the decision to get a vaccine. I mean, I hope they make that decision, but the idea of you have to do it. But right now, the only sort of mandating or proof of vaccination to go into restaurants has been completing your series, which would be 2 shots for Moderna and Pfizer, and then 1 for Johnson & Johnson. But as Dr. Mill and we've all brought up, that really you should get a second shot if you got Johnson & Johnson.
And there hasn't been much discussion around pregnant women in vaccinations or nursing women in vaccinations. And so the question just came across to me. If a woman that's nursing and is vaccinated, that just got vaccinated, does that mean if she's nursing her baby that the baby is vaccinated as well through the breast milk? Can you vaccinate a child through the breast milk? Through nursing?
So generally, through breast milk, there is some immunity conferred, and not a lot of community conferred. But it is helpful because at this point, what we're seeing is that we cannot vaccinate children under the age of 5. So we definitely need parents, families to be vaccinated to protect the children that cannot be vaccinated. For the 5-year-old and up, kids are getting COVID. 1 out of 3 of these kids have had COVID, but they're getting it because of families and school. So it's really important that those who can be vaccinated do get vaccinated so that they can protect those who aren't. Does that?
But we don't know for sure that babies are protected from breast milk. We think they are because of the other vaccines we've had. But again, it's so new. The data is coming in. We have to check antibody levels of these babies. But that the American College of Obstetrical Physicians is definitely recommending and believes that it's safe for pregnant people to get vaccinated, and that it's safe for people who are breastfeeding to get vaccinated, and that there is no risk, we believe, conferred to the baby or the fetus, and that the safest thing would be for pregnant and breastfeeding people to get vaccinated, and that there might be some benefit and it's better than nothing, but we can't definitely say that yet.
And definitely the risks of contracting COVID while pregnant are like up to 2 times or more for very severe complications, miscarriage, and maternal death. So the risks of that is just too high. So it would be recommended by all the organizations.
And Dr. McLaughlin, Dr. Ian, can you say that again, just so that people, that was what I was gonna ask you to highlight, which is the outcomes, the maternal outcomes for getting COVID and not being vaccinated. That's where I've seen what you just said, the like up to 2 times greater risk. Can you say that again so people hear it?
Definitely, the complications from contracting COVID during pregnancy are much higher, like 2 times higher than contracting COVID when you're not pregnant. So the benefits of vaccination during pregnancy far, far, far outweigh the risks. And you hear the numbers, but Dr. Franks and I, we definitely see these stories. We see what happens, and these are horrific complications, near-death experiences, and sometimes even death. So it's all numbers until it happens to someone you love. It's all numbers until it happens to a patient that you're caring for, that you've cared a lot for, and it's definitely traumatizing.
Yeah, we forget about the trauma on the doctors. One of the things that goes around in some of the Black therapist circles that I'm part of is that people forget that Black folks are still, as therapists, we're still experiencing everything a Black person is experiencing, which is all the stuff, plus then also seeing what's happening to our communities, and that can be so painful. So I just wanted to say to you, Dr. Ian, I hear you and I feel you, because it's a lot to see our people go through so much.
Yeah, I will say, just from a personal perspective, that back when Delta surge happened, for that week, I had multiple Black babies coming to the emergency department who I was testing for COVID. Usually it wasn't COVID, but sometimes it was. Usually the family was not vaccinated, and it was just this really scary reminder of how these disparities can how we can experience these disparities. And it reminded me exactly of, training in New York City during the AIDS epidemic, and unfortunately, Black people did not want to take the AIDS medications because of stigma. Now, there's a fear of vaccination because of some misinformation, but it still feels the same in terms of, that people die.
Yeah, that's great information. I see the anti-vaxxers starting to pop in here at the end. We're not gonna give them no play today. We're trying to educate and bring awareness to our community. But we have about 30 minutes before the end of the show. I know, Dr. Mo, you want to talk about resources. I think this is a good part to really start giving out some of those links, some of those websites, and kind of talking people through some of the resources for the community. But community, as we're getting close to wrapping up, 30 minutes left, please get those final questions out. Any hesitation that you've been thinking, or maybe it's something that you didn't feel was covered today, please put it in the comments and we'll get it out today so that we can make sure that those are covered. And I know that Dr. Mo has a number of resources that they're doing with the 94124 project at 1800 Oakdale, and there's another number of sites across the city that are doing vaccination, testings, and different things of that nature. So at this point, we can start rolling into that portion of the resources, and we can continue the conversation as well as comments come in.
Okay, great. So I'm going to start. Oh, go ahead, Dr. Franks.
I was just wondering if I could give a little information about pregnancy, COVID, just one last bit. In general, 1 in 3 pregnancies that happens will unfortunately, or depending on how the person feels, end in miscarriage. That is the truth without COVID. And unfortunately, we have seen with COVID-19 risks, the risk of something called intrauterine fetal demise, so that's death of the baby, is much higher than it is normally. And that basically it seems that people who have COVID-19 infection, they are more likely to lose their babies. And there has been no correlation with the COVID-19 vaccine causing the death of fetuses or death of babies. COVID-19 virus has been connected to the death of people, the death of babies and people losing their pregnancies. Just want to be very clear about that. There were some statistics being put out about people losing their pregnancies after getting vaccination, and just to remember that there has been nothing connecting the vaccine to miscarriage, and that miscarriage happens in about 1 in 3 pregnancies. It's a very, very common condition, unfortunately.
Thanks, Dr. Franks, for clearing that up.
So wanted to just highlight, first of all, the 94124 collaborative is a collaborative that we're funded through the Department of Public Health. And just wanted to really big up all of our community partners, both sides of the conversation, Umoja Health, YCD, Bayview Y, Department of Public Health, Kaiser, and the African American Faith-Based Coalition, because we have so many partners that are working with us. And so one of the things that I wanted folks to know is, and I'm going to start to put all this data, all these links up, is that if you do have COVID, call Rafiki. You can call our main line, or you can call, and I'm going to put it up again, or I can ask if folks will call or email Andre Akins, as he's our COVID response person right now. And so if you have COVID, you need resources like food, PPE, cleaning supplies, diapers, things like that. Just call or email Andre, and we will get you hooked up with all of those things. There is a phone number that I'm gonna put up in a minute, which goes.
I have it up. I have Andre's information up.
Oh, great, thank you. And then if you can put up the number for the state, John Henry, if you have it, where you have to sign up with the state if you're for the rental relief. So basically, if you're not able to work for 2 weeks, the government will give you a money for that. Unfortunately, the payment out on that can be very slow, but you can also go up to the YCD's hub on Wednesdays and Thursdays at 1800 Oakdale, and you can talk to any of the representatives there. You can also go to the Latino Task Force's site as well, out at, I think it's, I want to say 901 Alabama or 801 Alabama. And you can get resources like food there, PPE there, also job resources. You can get job resources at the 1800 Oakdale site as well on Wednesdays and Thursdays. From us, from Rafiki and our collaboratives, you can get vaccine through Fridays and Saturdays at 1800 Oakdale. Last Friday and Saturday, we were almost booked. Everybody kept their appointments. So you also have to have an appointment for the pediatric vac. So call Andre Akins, and he can get you linked up and get signed up for 5 to 12-year-olds need an appointment. And it looks like at this point that we're holding the last hours. We're going to extend our hours through the holidays. We're through that of and I'll give you the dates in just a second. But basically the holidays, so we're there every Friday and Saturday, but Christmas Eve day and New Year's Eve day will extend our hours. If you want to come by and get your vaccine. One of the things that we really do want you to know is that this is going to protect you if you want to hang out with your family. You know, they say, you know, full immunity or full protection, I think, is it 3 weeks? 2 weeks? Somebody will have to help me. 2 weeks. Is that right?
After the second dose.
Yeah, 2 weeks after the second dose. But already, if you're going to start getting it going for the holidays, you know, at least get your vaccine so that you're getting a little bit more protection. Of course, we're also wanting folks to you know, if you're having people over to the house that aren't in your bubble, eat outside, you know, throw it up in the backyard, get a fire pit, get something, get blankets, eat outside. You know, wear your masks because I'm very concerned that we're going to have another COVID surge. We're already still dealing with Delta, but this week we've had more positives in our 94124 zip code this week. So our numbers are going back up again, y'all. So we got to be careful. We got to be safe. We got to do all the things that we know how to do. So we have all of that, but then we also have our testing site. So if you want to know what's going on with you, then please do come out to the testing site. So we're testing on Mondays and Thursdays in front of Bayview Opera House. We're testing at on Kiska at 90 Kiska up in Hunters Point on Tuesdays, and on Fridays we're at 155 Jennings, and that's drive-through or walk-through. And then the site is also open on Saturday as well, but Rafiki doesn't person that site that day. But we are here for you. We're starting to get all the positives in 94124. We're getting it at a little bit of a delay. So that's what I'm saying. If you don't hear from us right away, reach out to us because it takes, through all the bureaucracy, it's still taking 2 or 3 days for us to get the positives. So if you need help and support, holler. You know, we have some gift cards. YCD, I think, has some gift cards at their hub. And like I said, there's all these other testing sites that I'm going to put up as well. So if you're in Viz Valley or out in Sunnydale, Susan and Drew and all the folks out there have a hub going on as well. So you can get tested out there. You can get resources out there. Same thing in OMI. We've got resources through Miss Felicia's organization. And if you're out in Western Addition through, I think, Booker T and through, I think who's the other one? It's Booker T and Collective Impact? Collective Impact. Okay, Collective Impact has resources. If you're in the TL, you can reach out to Glide. You can go to San Francisco AIDS Foundation. There's other organizations down there. The Chinatown YMCA, Bayview YMCA. So there's resources all across the city, and folks, you know, we just want to make sure you get what you need. So it doesn't have to be just with us, but just reach out to your providers because folks do want to serve you, and we do have resources. One of the things I do want to say too is that we do have the food. So Rafiki got an anonymous donor who gave us a bunch of money last year. And we're almost through all the money. And we're running a specific project where we're supporting Straight from the Heart and Miss Shug and partnering also with, y'all will help me in a second. I'll think of it in a second, their organization. But we've been partnering with them out at the park to have APRI, yeah. So, the money that we got, we're paying local community folks to, along with Rafiki staff, to partner in delivering food. So we're stipending folks so that folks get a living wage. Then also, we've got the food as another type of intervention, hot food and the food boxes. Because the thing that we have to look at is all the interventions is the economic justice and the food desert, as Brittany had said as well. So getting fresh, healthy food is a huge issue, and having healthy food is a prevention for both COVID and for mental health challenges and physical health challenges. So get your food on with us. You can also come to our clinic. So if you come to the clinic, just come about 15 minutes early for your appointment. Make an appointment. I'm going to put it up. But you can also call the main Rafiki line for massage, chiropractic, and acupuncture, all free for the community. And if you come to the clinic, we're going to rapid test you so that we feel safe, because our staff is getting tested every week. Our practitioners are getting tested every day they come in. We want to make sure that we're not transmitting anything to you as well. So also, if you have mental health needs, although, as I've been saying, we have about a 30-person wait list. I'm really working hard to hire more therapists, and just also hiring Black therapists as consultants to meet the need right now. So, we'd love a magic donor to come in and give us money to do this. And at the same time, Kudu Chakalia, we're going to figure out how to do it ourselves. So those are some of the things that we have. I'm going to keep putting that.
Dr. Mo, that was amazing.
Yeah.
It also, I think that Kaiser Permanente has some grants in many of those areas. So I think that there's like economic recovery grants, so small grants that I think it's up to $45 million. There's some confronting structural racism grants.
Hook me up.
Yeah,
Hook us up.
And there's confronting structural racism grants with up to $25 million to help improve social health. So there's.
You gotta hook me up with that. We're a collective right here, all of us.
I definitely want to concur about the services that Rafiki Coalition is providing, especially with the meals, because I was impacted by COVID. My daughter tested positive, and the groceries came, the support came. So definitely utilize those services for community. Andre, information is up on the screen. Please make an appointment. Get our young folks that those decisions that you make. Here's an opportunity. Get them in there. Get them secured. I know there's been some small spreads throughout not only San Francisco, the Bay Area, with our young folks in the schools. And again, we have elders in the house, and we have different folks that can be impacted. We want to make sure that we do the right things and get them supported. Very, very important stuff. But Dr. Frank, before we let you all go, a couple more questions from the community. I think this is a very important question to answer about people who are, compromising. And I know this conversation about sickle cell, we're going to have it on this platform. Again, this is another health issue that is impacting not only here in the Bay Area, but across this country. Sickle cell is real. I know UCSF just received $17 million to do more research at the Children's Hospital about sickle cell, but something with sickle cell in our community is starting to reform and come back in a major way. And again, that education and awareness, understanding when people are engaged in the union, those different genetic makeups and things of that nature, and how do we inform our community. So we are looking forward to having a powerful discussion on sickle cell. We're reaching out to a number of health organizations, and we have some connection through some folks that are going to try to bring that information, that education awareness to our platform. But I think this is a great point for you and Dr. Franks to reach on, because I know there's a lot of folks who are impacted. I have some other folks who are watching today who reached out and was talking about they want to hear this because they're dealing with Down syndrome and different things, and they have a different skew of thinking because they have been impacted in different way, and they feel vaccination have caused it. So I think this is a great opening to just kind of discuss some of that for community.
Sure. So great questions in the chat. It's surprising, but the only contraindication, so contraindication means reason to not get the vaccine. The only people who have a contraindication or should not get the vaccine are people who have had a serious allergic reaction to a vaccine in the past. So if somebody got the flu shot years ago or any of the vaccines, and had something called anaphylaxis. So that's a very serious allergic reaction, swelling in your throat, difficulty breathing, hives all over your body. If somebody had that allergic reaction to a vaccine, they should not get the vaccine, the COVID-19 vaccines. But anybody else should. So vaccines work by supporting your immune system, and people with cancer who are getting chemotherapy, people with sickle cell anemia, people with many different chronic medical conditions, even diabetes, these are all conditions that make your body have a weakened immune system, or an immune system that's not as strong. And so they are especially at risk of, if COVID-19 were to come into their body, to get really sick. And that's why they should absolutely get the vaccine and get the boosters. Unfortunately, for some people, like getting chemo, their immune system doesn't work as well. And so that means that the vaccine might not last in their system as long, because the vaccine helps the immune system, but it also needs the immune system to work. And so I would especially say that anyone who is immunocompromised or has cancer, sickle cell anemia, any of these conditions, they should get the booster, and should be looking out for announcements that they might need to get the booster more frequently, because their immunity just at baseline is a little bit less strong than other people's. Some people say, well, I'm not immunocompromised, I'm healthy. Why does it matter? If I get COVID, it's no big deal. And while it is true, most people who get COVID are just going to have cold symptoms. You don't know if you're just going to be that person with bad luck who has that different body that gets really sick. I work in the hospital too, and I've seen 20 and 30-year-olds in the hospital on oxygen, very, very sick from COVID-19 infection. I've seen 80-year-olds with all sorts of comorbidities, all sorts of other medical conditions, having COVID-19 and being fine. It's just, this virus is very, very random. And even if you get COVID-19 and aren't that sick, you might sit next to someone on the bus, you might see your grandmother, you might see somebody who could get very sick from it. And so that's my answer to, if people say that they don't think COVID-19 would be a big deal for them. It's not just to protect yourself, it's to protect everyone and to look out for everyone. But that I absolutely think that people with sickle cell anemia, cancer, getting chemotherapy, any sort of conditions should get the vaccine. The only people who shouldn't get the vaccine are people who have had a serious reaction or anaphylaxis. And most likely these people know who they are. If you're unsure, it's very unlikely that you've had a bad reaction to a vaccine before. It's something you don't forget.
Yes, I would totally agree. And, we're not alone. There's all these organizations. There's always, we're still in a pandemic. Please make sure that you have a primary care doctor. So you could also ask some of these questions too. So you could be sure. What we like to do oftentimes is, if you're actively getting chemotherapy, well, maybe we'll, give the vaccine after you finish that course, so that your body has enough time to build a stronger immune response. And to that same end, because it does really get the immune system working strongly, we sometimes don't want to do a mammogram immediately after, or 2 weeks within a vaccine, just because we know that your lymph nodes are going to be protecting you. So definitely great to use this as a chance to make sure that we are connected with your primary care doctor, and to discuss some of these things with them in case there's any questions.
And that brings me to my last point, as we got to get ready to close out here, because I want to be respectful of everybody's time. But I think that was a concern that the community had too when the COVID testing had started. And when people were testing positive or different things, they would say, hey, you can consult with your primary care physician. But in this community, the folks that we deal with, some of these people in the 94124 and some of the districts across the city who didn't have primary care support, how do we get those folks some support, or how do we get some of our medical folks in the community if they do test? And in the future, there was so many people that we talked to that just didn't have the medical support, and they was being diverted to go talk to a medical professional. They already don't go to the hospital. So how can we do a little bit more of that in the future. I think I would like to see more of our community health organizations help and support the CBO organizations to have some of that testing and get some of those answers asked. I mean, I had folks talking about just when they was getting sick, they couldn't get a doctor to write a prescription. They didn't have a doctor or they didn't have medical coverage. So we still have a lot of disparities that we have to address. And I hope, working with you all and Rafiki and a number of these organizations that we really broaden the model and be open to some of the things that needs to happen, because I think we learned a lot in this pandemic when we talk about our unhoused families and our unhoused folks. And I heard you say it earlier, how do we connect with those folks after they took the first shot? They don't have a cell phone and they don't have an address that we can leak up, or they don't have an email address, right? How do we be intentional to really be Johnny on the spot to help those folks? I know it's a challenge, but those are some of the things that we definitely need to look into and how to fix those. And, I know Kaiser opened it up later, but I know early on, if you wasn't a Kaiser member, you couldn't get that access or that service. I know it is now. But again, thinking forward in the future, right? Keeping these ideals and these things out there to know, how our community is impacted. And I heard Dr. Frank say meeting people out there where they at. How do we get all these organizations to understand that everybody doesn't have that adequate access? And just coming together to provide that adequate access, I think, is something moving forward as we continue to learn more about these different variants and, taking some of this knowledge and information that we learned from this first go round, because I think we're just not out of the box yet when it comes to what's going on with COVID and, just really strategically having these conversations and being intentional. And it's going to take a little bit of work and support. But definitely, I just want to keep that on the forefront as you all take that great information back to your leadership and to your organizations. And these conversations are very helpful here today, very powerful stuff. And I hope community appreciate the frankness, the direct information. I think this is the moving point in messaging that we're talking about. So I am very honored to have you all here speaking about this community. This is not a conversation about forcing you one way or the other. It's about bringing you information and making sure that you got the right information to make the right decision for you and your family. But again, these things are still happening in our community. So thank you all for today's conversation. With that being said, we at the wind it up period. Before we leave every show, we give every panelist an opportunity to leave some parting words to our community, to our folks who might be listening, to our elected officials, whatever. Just some positive parting words. And then we'll wrap up today's show, and then we'll have Miss Brittany at the end, who every week so eloquently put together a call of action, because I think every show there is a call of action that we need to have, not only for our community folks, but just for everyone in general, to be in solidarity to make sure that we move our communities forward when we're talking about health in our communities. So with that being said, Dr. Mo, you could go leave out some closing words. Dr. Ian, you can go after that, and then Dr. Franks, and then Brittany, and we'll close out today's show. And thank you all. This was very, very informative. Very great information. I see the comments. People are texting me. This was probably one of the top COVID conversations. So I appreciate the community for continue to watch, support, and give that feedback, and give us all the opportunity to make sure that we're doing the right things to impact our community. So Dr. Mo, take off with it.
I just want to say I'm grateful. I'm humble. I am humbled by all y'all's brilliance to be with you in this space. We can do this together. So, each one reach back, give back, lift up, because we got each other and we can't do this alone. And don't be scared to ask for help, because a lot of us have learned, like for myself, I grew up, always having to do everything myself, given what was going on with my mom and everything. And so I just want to say, ask for help. Don't be scared to reach out if you have questions about anything. It's, if you're hungry, we got food. It's no thing. Just be like, hey, Dr. Mo, what's up? I need some food. No problem, no harm, no foul. Like, just come through. Like, text me, hit me up. It's all good. I need diapers. I need this. I need that. I need a gift card. That's all good. I need help with whatever. It's all good. We got resources. We got a village. We got each other. So that's what I want to say is just like, don't be afraid to ask for help. Don't be afraid to feel like you're going to be weak or be perceived as weak. A lot of folks tell me, weakness is my tears could be viewed as weakness. But, frankly, if I didn't cry, I would be so depressed I would have killed myself a long time ago. My tears are my way of expressing anger, happiness, sadness, joy, disappointment, everything. So I just, my eyes water. That's what they do. But it because things are moving inside of me, they're not stuck. So I love y'all. Reach out. We're in this together. You're not alone.
Wow, powerful stuff. Thank you, Dr. Mo, for that. Definitely community. We have to reach out. The village approach is real. It's going to take us. We all we got. We have to do it together. And that's very important words. Reach out. We're putting the information up on the screens. If anyone has any questions or you wanted some information, please reach out to us at bothsidesoftheconversation.com, and we'll make sure we get this or connect you with these folks to make sure that you get those resources. Dr. Ian, go ahead and lead the community with some positive words. And thank you again, brother, for the information you brought today and handling today's conversation.
Again, gratitude and humility. Thank you so very much. And I'm so incredibly proud of the amazing contributions that our community has made to ending this pandemic. And I just want to make sure that we get the benefits of that, which is all the advanced treatments that are available. So again, congratulations and thank you.
No problem. Thank you very much, brother. Dr. Franks.
Thank you all for having me. It's an honor to be in this space. I'm also so grateful to everyone on this call and just the Black community and how we are strong and we are resilient and we are the leaders of ending this pandemic. And the most important thing we found, if you have family members who are not vaccinated, it makes the most sense to talk to a friend or a family member about the vaccine. People are much less likely to listen to a doctor or a nurse. They're more likely to listen to you. So just know that you are powerful and that you have the best chance of, making your family members get on board. And I also just want to emphasize, please get a primary care doctor if you don't have one, and ask these difficult questions, challenge us. We learn by interacting with you and are just so grateful for everything you bring to us. So thank you, thank you, thank you. This has been such a joy to be here today.
Yeah, thank you for giving up your time and thank you for your transparency, your honesty, your realness. I think that was felt throughout today's conversation. I'm seeing text messages, so thank you. That little bit of just being who you are is enough to change our community, and that's what we need, more folks to be vulnerable, be open, be truthful, and I think we could change this with you all. With that being said, Ms. Brittany, go ahead and wrap us up with your call to action for today.
Okay, thank you. I mean, everybody has said enough thank yous for this wonderful session. I really enjoyed this conversation, and I definitely look forward to future collaborations on how we can come together and just educate and inform our communities. That's what I'm all about, advancing health equity. So, just reiterating what everybody has said enough. And, these conversations that we've been having around COVID is basically us, bringing that same information over and over again until it's instilled in our heads and we know what to do, whatever that is. But, I just want to speak to the community and just tell our members to continue to stay informed and stay connected. That basically has been the basis of what we've been talking about, ensuring that we stay connected with our primary care physician or a local health organization, whether it's the case manager in your housing site, whatever it is, but, stay connected to somebody that can get you that up-to-date information, those resources, follow our Instagram pages. You've been seeing our pages popping up all throughout the show. You're going to get real-time information from Rafiki, from Wise Health, from both sides of the conversation, from Kaiser, from UCSF, Black Health Initiative. Everybody has all the information. It's just you got to get connected and you have to want this. You can't, we can throw it in your face so many times, but you got to want this and you got to do your part and play your role. Again, continue striving for a healthy lifestyle and think about what that looks like for you in the wake of COVID. What are we going to do in our communities? Because it's not just COVID, what we talked about. We still have HIV in our communities. We still got, our chronic heart diseases, all of our health disparities that we still have to address. So the work doesn't stop. Just what we put in for COVID, the efforts that we put in for COVID relates to how we're going to react with our body, with our health, with our responsibility, with all these other diseases. Everything works hand in hand. You know, all the health outcomes are the same. The disparities of our community produces the same health outcome, which is death in our communities. And this is what we're fighting against. So, you know, just continue to, you know, play your role. Everybody has a responsibility in this, I'm not going to say struggle, but in this ever-changing life that we are facing every day. Everybody has a role, and we can't do this alone. We have to do this together. You know, it's pointless for me to work out, get my shots, you know, do everything if my neighbor isn't doing the same. Neighbor, you got to do the same too, because we have to protect each other. So we have to put, one plays a role for the other. And so this is our responsibility as a community. And then lastly, I just want to speak to the community organizations that are, you know, like Wise Health and other organizations out here. You know, I was one of the ones that led the charge for, you know, getting Johnson & Johnson out into the community. And so hearing the conversations today was a little triggering for myself, because you could just imagine how I felt when, you know, the news came out and the community was like, well, what the hell? Brittany, we was listening to you. So imagine how I felt, you know, being the one to lead the community. And it wasn't just me. It was other people too that have been the face. And you have to understand that every day is different. And we as community organizations can only do our part to help you and to save you. And we're doing what we think is right. You know what I'm saying? And so as we move forward in what we're doing for the community, you have to be understanding of our actions as well, be adaptable, relatable, and all of that. And so I just leave you with those words. You know, we love you, community. Everything that we do is for the goodness of you. And so we're here for you. And just once again, thank you to all the panelists. Thank you to John for this platform. And thank you so much.
All right. With that being said, community, you heard it from Miss Brittany. The call to action is lead with compassion and humility, without judgment. There's a lot of things transpiring, things happen in our community. We need us all to work together to get out of this. This is not you, yourself, or I. It takes us all. So we have to be open, willing to work with each other, understand our differences, but again, push together so that we can move forward as a community. We thank you all for tuning in for this powerful conversation today. It's moved me. I had to make a decision about my granddaughter getting vaccinated, but just hearing the wonderful information and some of the questions that I had that was answered, I will be making sure that my grandbaby is vaccinated to make sure that she continues to do her part as well. And it's going to take us all. So thank you all for tuning in today. Our next live show will be this Tuesday. We'll have another segment of our hidden gems where we will continue to highlight our Black and brown businesses as well as our community organizations and their leaders that are doing positive things to impact our community. And then next Thursday, we'll have another segment of our Educational Thursday. And I believe we're going to have a part 2 of this Ask a Black Doctor town hall. We'll be reaching out to Rafiki Coalition and making sure that everything's in place, but we will not continue the conversation on Black and brown health in our community. This platform will do its part to help change that narrative. We're going to have some conversations coming up in the future. We're going to continue to focus on the health issues that impact our community. When we're talking about sickle cell, we're talking about mental health, we're talking about depression, we're talking about a lot of the health issues that sometimes our community don't have the conversation about, or it's too taboo, or maybe it's the stigma conversation. But here at both sides of the conversation, we're going to continue to reach out to our health professionals, get the data and the information to our community so that we can impact the change in our community. And if it means popping up, it means testing on site, we'll be doing that as well. And we're looking forward to work with all the organizations who care about our people, care about the community, and want to make that change. So thank you all for tuning in. We will see you this Tuesday night for another segment of Hidden Gems. Thank you, Rafiki Coalition, Kaiser, UCSF, and all of the sponsors who are behind the scenes, making sure that this information gets out to the community. We thank you, and we'll see you all. Be safe out there. Have a blessed evening, everyone. See you Tuesday night.